Uh, Very good afternoon, and thank you, Dr. Preeti. As a friend, she knows Shubha talks a lot, and she also knows she talks a lot to the patients. And probably it's our specialty where genetic counseling is an important part of management of the patients with and families with genetic disorders. So, though I haven't given any talk something like this any time about talking to the patients. Hmm. So that is why she might have thought that I can talk to you about communication. And I keep on talking about communication in the lectures on genetic counseling. So this picture reflects the situation where the genetic counselor is talking something jargon, English words, mutation, recurrence, DNA, CVS, many short forms, risk, while the wife and husband, they have different perspectives about what they want to know, and that they don't have like there is probably no good rapport with the genetic counselor and the patients, and both husband wife, they are really having very different perspective of the whole situation. So such type of situation, the communication is going to be really failing, and we don't want this to happen. And that is why we want to find out what would be the best way of communication, so that the whether whatever is whether you are taking consent for the surgery, whether you are giving any information, what are the choices for intraocular lens implant, or you are doing DNC, everything. So a lot of things, there are always multiple options and lot of information. And many times as a doctor, we are ready and prepared to give advice, and naturally that is the correct thing in most of the situation, that in this situation cesarean section has to be done, that is the best situation. However, now over these days, uh, all there is a sort of, it has developed that the patient is provided all information, and patient is and family is involved in the decision making of the about the disease. And hence communication is very, very important for every specialty and every doctor of every specialty. uh, the question is, how do we learn about communication? As Dr. Preeti rightly said, it's not something that you teach and then you do an operation and then you learn. If you do 2 times operation, you learn better. Same way, if you talk to the patient number of times, you really learn a lot. There were some residents who used to keep Duchenne muscular dystrophy and recurrent abortion patients' files in her drawer and go away, because she thought there is nothing to learn from these common disorders. But when you talk to every patient with Duchenne muscular dystrophy, their family, they have different issues and their recurrent abortions, even the neurological examination. So there were some residents, on the other hand, would do detailed neurological examination of each patient with DMD. So more and more you get an experience and more you are involved, then you will learn the process of genetic counseling as you learn other part of medicine. The second thing is that you learn from your teachers. The things have changed, but when I was doing our MBBS and MD, that time the consultant, especially senior consultant, who used to take round. So the consultant, then some associate, assistant professor, senior resident, and the junior most house officer. So there was so much of aura and physical distance between the patient relatives and the senior consultant, as well as the, so there was hardly any possibility that the patient relative, even for rheumatic, at that time most of the 4 or 5 patients in pediatrics were rheumatic heart disease. So they need to know that what is happening to their child, and then there was no way that they could ask. I had read about one story or experience in some Marathi magazine some time ago, long ago, that in ICU there was their father was admitted, an old man, and naturally all children come from outside, they keep on doing duties and go inside and see them, and every laypersons feel ICU is such an impressive thing that everybody feels that the patient who is going to ICU will definitely come out alive. And on the hand, on the other hand, sometimes as a doctors we feel ICU में जाने के बाद बहुत ज़्यादा risk है. but patients don't know that. So they didn't know anything, and they said they were doing this for 8-10 days. And finally, one of the brothers mustered the courage and asked the house officer that how is his father? What is the situation? He is on ventilator for 8 days. What happened? So residents are usually tired and overworked and burdened, and they are not so sensitive. So he roughly said, "अरे ये तो vegetative है, अब कुछ नहीं होना है." So that was the thing, they got the information. And this nowadays it probably doesn't happen, because there is a time that because they are the patient relatives are taken, and then every day they are updated about the information and so on. But this may be happening still number of times. So and what happens, so the point is, any serious information other than cat test karna hai, but if it is a costly test, then the rest, like we do NGS based testing, so the senior doctor has to tell what has to be done and what is the outcome and so on. You should not if the child with Down syndrome is born, obstetrician is sees and neonatologist sees, but they leave it to the house officer to tell that this child has Down syndrome, who feels why to tell now, jab koi 3-4 mahine baad vaccine lagane jayega tabhi bata denge. So that's how it happens. So the responsibility, especially of giving bad news, you have now a class on that, so has to be taken by the senior consultant. This slide summarizes the all of our communication process. Basically, it's a large amount of patience, correctness of information, communication skills. So communication skills mainly involves command over language. And I would tell you that everybody and that television and everywhere, and we are all started talking everything in half Hindi. And once many years ago, 20 years ago, I listened to the interview of Mark Tully, and we realized that after living in India, when he gives interview in Hindi, he doesn't use even a single English word. So some words like table and some things which are there in us, in our language, other than we should, when we talk to patient in Hindi, we should talk in Hindi. It's not that we should talk in very cliched Hindi, but almost everything has a Hindi proper word. And sometimes, like if it is abortion, abortion is commonly used than garbhopat. But if you are using abortion, then use once a garbhopat and then abortion, and decide that what you want to use further. So ऐसा जो sometimes our residency कि CVS कर लेंगे, अगर fetus affected होगा तो फिर abortion कर देना. So अब CVS क्या है पता नहीं, fetus क्या है पता नहीं, mutation मिला तो क्या पता नहीं. So this type of communication is extremely hazardous, and his language is very important. Over years being in Uttar Pradesh, I learned Hindi, and like everybody of all of you are from South India, and everybody has to learn some amount of Hindi. And if there is something major thing, and if you don't know the language, then you can say that, take your friend and say that he explain them in Hindi. Sometimes what happens, the parents like they are the mother is with diamonds and everything, very fancy clothes, and we feel that they are very smart. They sometimes talk using wording words like very so we think that they are very educated, but it may not be so. So some you have to ask, are you comfortable with Hindi or English? Especially South Indian people, then many times they prefer English. So but every smart and modern looking person may not be very comfortable English. उस पे मुझे एक जोक याद आया, एक our resident was from he had done MD in pediatrics from Bombay. So he came and he was talking to the patient. He told the story that he was taking history in Bombay, and then he thought that he is not understanding, and he told the mother कि मुझे मराठी अच्छी नहीं आती है, तो अगर आप हिंदी में बात करेंगे तो मुझे पता अच्छे से पता चलेगा, शायद मैं ज्यादा समझ पाऊँ. तो मदर टोल्ड मैं हिंदी में ही बात कर रही हूँ. सो समटाइम्स इट कैन बी सो कंफ्यूजिंग. Same way South Indian resident था, he properly was talking to the patient. He never made an issue कि मैं यहाँ पे आया हूँ, और he was already assistant professor, still he was working like student. एक दिन वो बगल वाले रूम से he was asking सब ठीक हो जाएगा, परेशान मत करो, परेशान मत करो. 3-4 बार हुआ कि मतलब ट्रीटमेंट हो जाएगी, ठीक हो जाएगा वगैरह, ठीक है. फिर मैंने आस्क डॉक्टर शंकर कौन परेशान कर रहा है, सो परेशान मत हो. सो समटाइम्स लाइक we have to really so command our language is important. Coping skills, And these, before that, I think our knowledge, when you are going to talk to the patient about a disorder, you may tell a small thing, but you need to have a detailed knowledge of what you are going to talk about. And then this is a very, very in simple language. When you see Discovery Channel, they talk about atom bomb, they talk about Darwin's theory, they talk about gene therapy, everything, but in a language layperson can understand. So don't underestimate that because the patient is very uneducated, class 10 pass or fail, so he will not understand scientific things. So there are ways that those could be explained in a very, very simple fashion, but oversimplification so that the content gets distorted should not be there. Other things in any reaction, anything, ki courtesy, confidentiality, kindness, understanding about the depth of human mind. This picture is by Isher and it shows like it's a three-dimensional picture, and when you talk to the patient, you continuously get feedback of his or her mind if you are receptive. And eye contact is very, very important for that. So the many times you get into idea about what that person is thinking, and that continuous feedback makes the communication better, because what he is expecting, and before that, unless you know what he or she is expecting, you would start telling what you want to tell. That sometimes is hazardous. So many patients come to us for treatment, and you know that there is no treatment, you want to tell something else. So all these very, very important, and clear instructions. When we say this test has to be done or whatever is there, the instruction should be clear, no confusing commands, and those should be properly given in writing. What I told about scientific information and complex information, again, like giving example of Discovery Channel, that cannot be simplified to the extent that ultimately the correctness is lost. So we should not give incorrect information in the, like, abortion ho gaya, so we know that 10% of pregnancies spontaneously abort and 50% are chromosomally abnormal. But if the patient is under follow-up of obstetrician and if spontaneous abortion occurs, the obstetrician tells, मैंने बताया तो था ना, चलना नहीं, क्यों चली होगी, फिर वो पेशेंट एपोलॉजी, हाँ थोड़ा सा ऐसा हुआ था, फिर उस दिन मैं घर से बाहर गई थी. So such type of things, I think, in this era where we know what we know, we should not be given. Then the communication involves non-directive counseling, as in case of genetic counseling, but there is sometimes like medical advice. Most of you will be involved in medical advice, and then there is combined decision taken with the patient, and all these things need empathy. So here the picture shows that the artist has become the picture himself. So here it's not that we are so like we try to make decisions for the person, but we should have empathy and we should think how the patient thinks. But we cannot order or decide sometimes in non-directive counseling for the patient himself or herself. But sometimes medical advice can be sometimes little different. So coping skills are very important. When we have seen, and you might have seen, different patients and families with multiple problems, medical problems, long problems and all that, and there are 2-3 individuals affected with serious disorder, and we realize that the coping skills of the families are immense of individuals. And in fact, that helps us to understand how to tackle the problem, and also it helps us to gain strength from them, how to cope up with these problems. So not only this good communication is for them to help, it also helps them in long term, and probably sometimes it gets into it helps you to take care of your problems, your psyche, and many a times it gives you, it makes you humble. So there are some patient stories through which I kept on learning, and many times one have made mistakes, and those mistakes I also remember that what happens. So these stories, one keeps on listening, but if one is sensitive, if you are not sensitive, then you will not perceive anything what the patient is saying. This is a story of a pregnant lady. At 33 weeks, she was referred with Dandy-Walker malformation. And Dandy-Walker malformation is a very easily treatable disorder. But when we did ultrasound, it was a single ventricle. So holoprosencephaly, brain is not divided, and these babies are not compatible with survival. Their head is very small, so naturally at this time there was hardly any option because baby was 33 weeks. The in-laws and the mother were there. The husband was in Singapore, so mother told that she wants her husband to come here. So she said, I should tell the in-laws that she should come. And a lot of things, like here we couldn't do nothing, but then there was delivery, NICU care, home oxygen therapy. The baby also had complex heart defect and ultimately died. So in this process, what is our role? Because we had told about the possible outcomes and they were prepared. So though the news was given bad, but they might have realized somewhere that we are with them. So they kept on communicating us, and we tried to help as much as possible, like creating trying to find out about ICU and so on. And there was a gentleman. So there are many common people amongst us and in the patients who are like many times quite extraordinary, and we learn from them. So there was there was an old gentleman who used to come with them, neighbor, and he was like their sort of, everybody wants somebody outside who has the strength to support them. And finally he came to us to tell me that the baby is no more. So in this process, though we had given bad news, so we ultimately we had seen that this particular we have to be with them. The correctness of information is what I said, truthfulness. And this is another picture we show. You can see that there are some geometrical gimmicks, and that's why you make that this the steps, whether they are like this or climbing up same way at the same level, the waterfall is there, but here why this point has come out. So these are just diagrammatic mistakes purposefully made. So such type of distortion of talking we many times do in giving information. Just make it trick so that it sort of right looks correct. So such type of things should be avoided, and truthfulness should be there. Now we have many techniques which really have a very high resolution, and like karyotype, but now there are very high resolution chromosome analysis, and you can see it's like comparison of map to the Google Earth map. Here we can see this is the SGPGI, and there is very high resolution where you can see the each room of a crow. Then this is called next generation sequencing. So, and this is the Imambada seen in Google Earth. It's an important archaeological monument in Lucknow. So many times you get more information, and that more information causes lot of problems. So don't think that more information is always useful, but it creates sometimes many uncertainties. But because you have to use the information, you have to tackle the uncertainties also. So this is a situation where the couple had two girls who died, and they had some parotid abscesses, septicemia, everything. So they said, unless we know that the next child could be normal, they will not plan a pregnancy. And because this is consanguinity, we said it could be risk of recurrence could be 1 in 4. Because the girls were not, the samples were not available, we tested both the husband and wife by next generation sequencing, and identified a sequence variation in a gene which is for immunodeficiency. So now this variation is not reported any time in the literature, in the all websites, everything. So it's very difficult to tell that if for this uncertain thing we will do prenatal diagnosis, but because we thought it could explain their phenotype in the girls, so we did prenatal diagnosis. The baby was born looking normal, but till 1 year the parents were very anxious because we had told that there may be some error rate. We were very anxious, and a lot of anxiety is there if you do some such uncertain significance findings are there. Finally, by 1 year, because otherwise he used to keep on sending me WhatsApp head circumference and that neutrophil count every time, and I used to feel that this is normal, but ensuring everything is very difficult. So truthfulness and uncertainty, it takes a time to learn to share these uncertain things with the patients, and this you learn with the practice. Then there are many things, some things like there are the situation in the psychosocial things are very important. In this family, all of them had eye problems leading to blindness. This boy was 16 years when we saw, and we told that we can do prevent this blindness passing on to the next generation. So they got all investigations done. by sending samples to the some other country, though they were not very well off. And then we got the reports ready. After 4 5 years, then they came, and then they told us that they want prenatal diagnosis. So the wife of that particular boy, who was now about 21-year-old, she said that she doesn't want prenatal diagnosis. She thought terminating a pregnancy for just an eye disorder was not really justified. That's what her perception. And the family from low socioeconomic honored the views of a daughter-in-law, which is quite rare in Indian situation. And so such type of autonomy is there, and the family. So we have to help the everybody to take their own decisions. So this means ki communication is bidirectional. What we told, that what I tell them, but I had to know what they want. As I said, whether they are receptive, there should be a proper understanding of their emotional state. Many times they are into denial or very sadness, or sometimes very anxious. So all these things make communication very difficult. And nowadays, most of the times, what the referring physician has told, or what they have learned from Google, and then all these things, unless you know, you will not be able to communicate properly. This is an example of what family wants. This family, both of them had some abnormalities of mandible and ears. And we were naturally interested, because we are interested in such malformation syndromes. We did next generation sequencing and all that. But they had three deaths during intrauterine death and neonatal deaths, and all of them had jaundice. So what they wanted was not, they were like least bothered about the mandible problem. So what you want to decide what the family wants, and then I work accordingly for them. So um, such type of stories are very many. And then many times this long story, like the patient comes to us after the two sons died, nobody is alive, then they come after the new third pregnancy born, then we test for one disease, then that disease is not there. Then all this story runs over few months, 6 7 months, 8 months. And then there is a rapport. They feel at least they had gone to different people, and this is the only doctor who has some understanding of the problem. So they kept on communicating, and finally the baby was diagnosed, not any inborn error of metabolism, but immunodeficiency disorder. So we tried to organize bone marrow transplant for that patient, but by that time the patient was being shifted to Delhi. The baby developed pneumonia and finally died. So what I mean to say, that when you are involved deeply into those families, they understand that you are concerned about them, and they keep on communicating to us, so that long term follow up will not be possible unless you have good rapport with the family. So these good communication skills involve listening. Many people are not at all good listeners. Time is not there, and then they are so hurried. And lot of then many people are not do not have any understanding about non-verbal communication. If there is no eye contact, there will not be any understanding of communication. Confidence in what you are talking, eye contact, empathy. So all these things make the communication much more reliable. And most important thing is respect for the patient and family. So there are uneducated patients, a lot of other things, but if you treat them respectfully, because they are the patients, they have come to you for help, and that small amount of respectful behavior is very important. And sometimes it does happen that you also always, the one of the thing is that when resident shows you the patient, or you show a patient, just tell that Mr. So and so has come for this thing, or Mrs. So and so. So refer the patient by name. This is very important. नहीं तो फिर सिर्फ patient का नाम form भरते समय दिखता है. That should not happen. And then you should address that during that patient to the patient with the name. That makes its communication much successful. I would not go into many stories, because there are many, there is no end to it. But sometimes what happens, the patient has come for something extremely different, and you want to give a very important information for the family. Like Duchenne muscular dystrophy, you may be knowing, This boy was a 20-year-old boy, 18-year-old boy, and his younger brother was diagnosed with DMD 10 years ago. So when he thought that he has become adult, he was very concerned by the pain of that his brother with DMD, and nothing, no treatment is there. So he said, now parents ko chodo, main jaake baat karke aata hu. So he came with us, and to tell that even after 10 years there is no curative treatment was really very, very saddening. But that was the only situation when I found, and he had two, three sisters, and three sisters, two were married, one of them had a boy. So it was very important to tell them that the sisters may be carrier and they may have child with DMD, and prevention is very, very important by testing the sisters who can be carriers. So tried to give this information, and told that this is very important. And really, though, I thought that sometimes he was so disillusioned with lack of treatment that he might not have pursued. But really, he came after 2 weeks, and one of the sisters had a boy who had DMD, and he had courage to tell his brother-in-law that this is the same disease as my brother, and at least for next pregnancy they should do the testing and prevent recurrence. So such type of things, unless you have a good rapport with the family, they will not be possible. So such type of stories we do write on our genetic clinics, which is a publication of our Society of Indian Academy of Medical Genetics under Heart to Heart Talk. And these are the two sisters with multiple fractures. They are just like this 22-year-old 2 feet, and if you put them on a website, like you can see, they are doing lot of music programs with Himesh Reshmiya and everybody. So how strong somebody can be, and such type of stories really help us to understand. And we had this item in our publication, and then I got to know that there is a specialty called narrative medicine, where you keep the patient at the center and not his or her disease. So basically, narrative medicine has developed principles and practice that equip clinicians to better comprehend their patients' experiences and perspectives, so as to deliver equitable and effective healthcare. So you should not treat only the gallstones, but you should too see that what is that person's other issues, as well as socio-economic issues and lot of things. So these people are realizing that it is very important to treat the patient. And long ago there was a concept, log kehte the कि ये डॉक्टर साहब से तो दो शब्द बोलने से ही आधा मरीज ठीक होता है. So it may be exaggeration, but really it's very important that you get the rapport with the patient. And again, talking to the patient and seeing that he or she is not offended is very important. Sometimes not only the doctor, but even the relatives also. These were short stature gentlemen. Many were college professor, principal of school, and their sister who was recently married, and both of them were quite beautiful and handsome. And they wanted that their children should not be as short like these people, should not have the same disease. So we told, bring them. And these all three brothers came because they thought it's important to tell the help the sister. So we were talking to them, and we should find out, and probably they had growth hormone deficiency, and we were talking to them about, and they were very nice and educated people. But this gentleman, the husband of the girl, was so rude and type of telling, "ऐसा बच्चा नहीं चाहिए, ऐसा बच्चा नहीं चाहिए." So as if they are something very abnormal. So this is something which you have to see that this should not be trust, and we have to tell the same thing. Of course we couldn't, we had to subtly tell that gentleman कि वो भी पूरी तरह normal है, वैसा नहीं होगा ऐसे water. But this is very important for consultant, that we should not talk in front of family with the residents. Otherwise residents are excited with the diagnosis, and they keep on talking anything in front of the patient, which really cause harm to the body image, give misinformation, talk about something rare treatment which is still not available or something like that. So yeah, they may have incomplete understanding. Hence resident के सामने discussion होना चाहिए, वो patient को बाहर जाने के बाद. That is very important. So lastly, I was told to talk about communication with the students and colleagues. So this is an extremely difficult thing. Students, I think everybody learns and about thing. So with students and with head of the department, one has to know that you are a leader, you should work and the way you want, and have to show the way and not to rule. So this is true to some extent, but sometimes you have to order also, because some people don't learn by observing. But this is the principle. And secondly, this is for children and students. Don't worry that children don't listen to you, worry that they watch you. So when you talk to the patients, and also the residents are observing, students are observing, and this is very important. Regarding colleagues, respect is very important. Give them important independence. So departmental colleagues as well as other departments colleagues, because we have many times interdepartmental meetings and lot of things are there. But sometimes what happens even with the colleagues, especially if you are HOD, sometimes not that HOD can please everybody. You have to take tough decisions. So sometimes there are differences and some relationship don't work. So one used to get very disturbed by that. But I read somewhere that not all relationship work, and it is not always your fault. So you have to try to mend your ways. But remember, you can't please everybody. Have to implement discipline and work culture. So for this situation, one can this approach by Mirza Ghalib can be really taken as कुछ इस तरह मैंने जिंदगी को आसा कर लिया, किसी से माफी मांग ली, किसी को माफ कर दिया. So some that is at least very important to have your peace of mind. So Mendel, who started these experiments and started about knowing about monogenic disorders, and with that gradually clinical discipline of Mendelian disorders and medical genetics came into play. Over 30 years, all these genetics I have learned a lot. But this importance of not only learning medical genetics and monogenic disorders and newer recent developments, including gene therapy, but more important is it gave me really some insight into opportunity to learn the minds of different people, and that way probably one can learn. So I would conclude by saying that look for art in the science, don't forget science of medicine, care for human in the patient, and never ignore your conscious. So many of the pictures are by an artist, MC Isher, who was he has a very extraordinary three-dimensional perception, and that is why his pictures are very interesting. If you put his name, you can get in Google all these images. So I would like to end by telling that whatever I told, there are many times I make mistakes. I might have, I haven't learned many things. So I still have to learn a lot about human mind, and see that I make less and less mistakes, not though not zero still. uh, Doctor dispenses not only medicines but also words. So I would like to tell that words are healing, but words also can cause have adverse effects and cause damage. And this is well written in these lines: I cut deep, said the knife. No, look at me, I would give severe wounds, sword claimed. Words laughed behind the curtain.